Florida Attorney General Pam Bondi and the governor will be holding a series of community meetings in areas hit the hardest by an epidemic of opioid overdoses. One of the first of those meetings will be right here in Palm Beach County. Senator Marco Rubio joining us to discuss this and a number of other issues. Good morning, Senator.
Good morning. How are you?
I'm doing well. What's being done on a federal level to tackle this problem?
Well, I mean, there's a couple points that I'm working on. The first is the rise of fentanyl, and Ed Markey, a senator from Massachusetts, and I have filed a bill that empowers or gives the Border Patrol and our border agents devices that allow them to test in the field for fentanyl, because all of the majority of it is being trucked in across the border. The precursors are sent to Mexico via Canada. It's mixed, and then it comes over, and then, of course, it's killing people. So the first is to cut off the supply. The second is to cut off the demand, and the way you do that is you provide more treatment options. So last year we passed the CARA bill in the Senate and authorized the funding to open the door for more opportunities for people to receive treatment and recovery. And I'll be meeting, of course, today with the state attorney, Dave Ehrenberg, who's been kind of heading this task force. We'll be talking over the next few days about some of the sober home issues, which are interrelated, of course, with the issue of recovery.
Yeah, no doubt. It's been a huge issue, the sober homes, especially throughout the Palm Beaches here. And that kind of segues what you're talking about over into one of the real hot buttons that a lot of us are wondering about, and seems to be the top issue that might be taken up when you get back to Washington, and that is health care. The latest research from APNORC says that health care is a very important priority to 86% of Americans. So people want the reform. Where are we with it, and what is your expectation at this point?
Well, I'm surprised it's not 100%. It should matter to everybody.
Yeah.
And I think it's important to have perspective here. The vast majority of Americans have health coverage from their job or Medicare, and those who have low income have it through Medicaid. So really, the crux of the issue that we are debating about is about a not insignificant number of Americans, something like 11 to 14 million Americans, about 6 to 7% of the population, that doesn't have health coverage from the government and doesn't have health coverage from their employer. And that is why we need an individual marketplace that works for more people. And that was the fundamental challenge that we had before Obamacare. It's the fundamental challenge we have now. Obamacare chose to deal with that by the creation of these exchanges, which in and of itself, the idea of an exchange is not a bad idea. But then they loaded it up with both subsidies and mandates, which have made it, quite frankly, not either cost-effective or available to many people. So what you have is a situation now where even with the subsidy that's available for many people, you don't have enough young and healthy people signing up. And the result is that you've got these spiraling costs that eventually require more taxpayer money in order to make these markets work. So that's what we really should be focused on fixing, is what do we need to do to create an individual marketplace in Florida and across the country that is affordable and that has the right patient mix so that it's sustainable as well. And that's what I've been focused on, and that's what we'll continue to focus on getting right.
Well, Senator, something that I hope is in the forefront of reform when you get back to Washington is actually the root cause, which is cost. You know, I have made the analogy that we would tell any other business or any other industry to pound sand. If we walked in, they told us to sign a sheet of paper. We would have no idea how much we would end up having to pay for whatever took place in there. But, you know, they'd let us know after, you know, our insurance company had dealt with it. The health insurance model in our country right now seems like it's backwards, to where price transparency is masked because of the insurance first model, and it becomes just this fight between insurance providers and medical service providers. Wouldn't we be better served if we emphasized HSAs and had a consumer transparent model for pricing and service the way we do every other form of commerce?
Yes, and I think those concepts are good concepts. It's important to note, though, that healthcare is not a purely free market product. In the free market, if you don't pay for it, you don't get it. In healthcare, we tell providers that if someone shows up at the hospital and they're sick, you have to treat them, stabilize them, and you may have to keep them if they're very sick, whether they can pay you or not. And, of course, I'm not saying that we shouldn't have that. I'm saying that it's not a pure free market product, but it is. Transparency is important. You're right. If you go to a hospital and you ask them how much is an appendectomy, they usually can't tell you, and it depends. It's a negotiated rate with insurers. They pay one thing for Medicaid, another thing for Medicare, one thing for this plan, one for the other. And if you pay cash, people would be shocked at the cost. So it is about empowering consumers. HSAs, I'm a big fan of them because I think that it provides people with the opportunity to control their health care spending and place it in the right position. it is not an answer in every instance because there are people that simply don't make enough money to put the money in an HSA. So it's complicated, but I think ultimately the goal we want is to do what you're saying, and that is empower the individual to control their health care spending, because then the private market will respond to that by creating products and pricing that makes sense.
You're listening to Senator Marco Rubio. The next one up, I wanted to have you speak to taxes. We've heard the president say that, hey, after the initial health care bill failed, we're going to move on to taxes. We're now hearing the president say, hey, you know what, we really do need to tackle health care because that provides the better outcome for tax reform. Where do we stand there?
Well, tax reform is an important thing for economic growth, and some of it is dependent on the savings or the money that would have been made available for health care reform, which I still hope will happen. A lot of it is just common sense because the economic growth is actually going to create more revenue. For example, if we can lower the corporate tax rate and go to a territorial system, we can bring back over $2 trillion of American cash that's parked overseas. And that money comes back to the United States and is invested here. It's going to create more taxpayers. It's going to create more jobs and more growth. And more taxpayers means more revenue to pay down our debt and to fund the important things that our country needs, from the military to social services. And so I think it's important for us to understand that tax reform is not just about making taxes cheaper. It's about helping the economy grow so that more people have jobs. The more people that are working, the more taxpayers you have. And the more taxpayers you have, the more revenue you're going to have without having to raise taxes.
The Zika virus, we're starting to hear some more noise about it as we head towards the summer. What was learned from last year that we could take into this year?
Well, one thing I want to change is I want us to, and I've talked about this now with my colleagues who have been working on it, we need to have a permanent fund that's available for outbreaks and pandemics, whether it's Zika or Ebola or something in the future we can't foresee, because these things move very quickly and the congressional process takes a lot of time. I think the other is getting out ahead of it, and I think Florida did a good job of it last year, and that is identifying the places where this is happening, jumping on it as quickly as possible. I'm working on a reauthorization of a mosquito control plan that lapsed a few years ago, and it provides up to millions of dollars in grants to local jurisdictions around the country to get ahead of the curve when it comes to the eradication and limiting the spread of mosquitoes. So we learned last year that eradication works. You're never going to wipe out every mosquito, but what you don't want is these massive pockets of infestation, which makes it an ideal scenario for spread. So I just wrote the president last week and reminded them that Zika season is upon us and that we should not assume that this thing is over. There's no reason to think it is. That we could have problems again this year if we don't deal with it in the front end.
All right, good stuff. Thanks for taking the time with us this morning.
Yeah, thank you for having me back on.
Yeah, you bet.